Hello, this is Lisa again, and this is going to be Chapter 11, Part 2. So we're going to be starting to talk about fire and electrical hazards. In your text, it actually shows this cute little picture with a triangle, and what it's saying is in order to have a fire, we need three different components. We need fuel, we need heat, and we need oxygen. When all three of those things work together, we get fire. So if we can stop or contain one of those three things, we will be able to stop the fire. So one of the big things that you need to know where you're working is you need to know where all the fire alarms and all the fire extinguishers are. This is going to be really important because if a fire happens, you need to be very familiar with your surroundings because there is going to be a panic. And you have to be able to know without a doubt where to go to get the fire extinguisher or pull that fire alarm. The other thing that you have to do is you have to know your emergency routes. And we're going to hand our little picture here. This right here is, if you notice when you're in the offices or if you're in a facility, by every single door, there will be an evacuation route. The same thing with a hotel. If you look on the back of a hotel door, it is going to tell you how to get out. So those have to be posted. So in case there is a fire, the patients and staff are aware of how to get out. The other thing that we have to do is we have to remain calm. This is going to be really important because if you're running around like a banshee screaming, "Oh my gosh," the patients are going to freak out. So we need to remain calm. Get that fire extinguisher if it's a fire small enough for us to put out. Pull the fire alarm and remain calm. And here's our little fire triangle that I was talking about. Oxygen, heat, fuel, and that makes fire. So if we can get the oxygen taken out of this, then we're going to be happy little campers because we can't have fire then. You know, campers with a campfire. So there's two abbreviations or acronyms that you need to know for this chapter. And the first one is PASS. And when we use PASS, this is when we need to learn how to use a fire extinguisher. Okay? We're going to be able to take the fire extinguisher into a room or wherever it is and be able to use it and hopefully put the fire out. So when we say PASS, the first thing is pull the pin. And this is the one thing that when people get under pressure, they forget to do. You've got to pull the pin out because you can squeeze as much as you want. But if the pin is in there, it's not going to engage. So you've got to remember to pull the pin. You're going to aim the nozzle and you're going to aim it at the base of the fire. It needs to get either the oxygen taken out or it needs to take the heat out, whatever it is, but it's at the base of the fire. You need to then squeeze the handle and you're going to sweep back and forth along the base of that fire. So this is a cute little visual of what PASS is. Again, pull the pin, aim at the base, squeeze the trigger, and sweep. For those of you that are in the medical assistant program, you will actually be putting fires out in the parking lot because it's one of your competencies. So you're actually going to get the opportunity to use a fire extinguisher. One of the things when we talk about fire extinguishers, there are different types of fire extinguishers for different classes or types of fire. So a class A is for ordinary combustibles. This is going to be paper, mattresses, sheets, whatever it may be that's burning, plastic. So this is like a trash can fire that we would see. Class A fire extinguishers are water. They're either pressurized aqueous forms or water. Class B fire extinguishers are flammable and combustible liquids. When we talk about Class B fire extinguishers, this is going to be CO2, carbon dioxide. And what it's going to do when we put it at the base of that fire, it is going to suck all the oxygen out, and it's going to take that oxygen out, and then the fire will go out. And it just kind of smothers it. Okay? So there are other different types of fire extinguishers out there. There's one that's a BC or an ABC. We're going to be talking about ABC because those are usually the ones we're going to have when we're working in a healthcare facility. Class C are going to be electrical fires. And this is going to use a type of carbon dioxide as well, but this is specifically for electrical fires. It is very important that you don't use a Class A fire extinguisher on an electrical fire because then you can get electrocuted. So you really need to be paying attention to what's going on and, you know, what type of extinguisher that would be good for the fire. And Class D, this is for actually burning metals. We don't see this a lot in healthcare at all, but it's out there, so you need to be aware of it. It actually uses like dry sand, and it forms a crust over the fire, and then again kind of takes away the oxygen and smothers it out. The last one that we're going to talk about that's not on here is the ABC extinguishers. And what that is, it's really a multi-purpose fire extinguisher that you can use on any one of the 3 A, B, or C types. So this is why we normally see these in the healthcare setting, because we don't know what kind of fire it may be. We don't want to have to stop and think if there is a, you know, if this is electrical or if this is trash or whatever it may be. So you'll be using, excuse me, that ABC extinguisher. And again, that's going to be a foam. It's like a dry chemical, not a foam, I'm sorry, a dry chemical that just blankets the burning area and interrupts that chemical chain reaction. We'll be using those in the summer for those students that I talked about, and these are messy. They leave a powder everywhere. So you definitely know when ABC fire extinguishers have been used because it is a mess. The second acronym we're going to talk about is RACE. And that is when there is a fire in the facility and we need to act. So let's say we try to pull the fire extinguisher out and the fire was way too big. So now we have to kick into RACE. The first thing we're going to do is either rescue or remove your patients. Now, a lot of times what we have to do is think about that. If we're in a large facility, they have fire doors. So if it's like 3 floors down and it's not a huge fire, a lot of times they'll say just wait until we talk with you to see if you need to move your patients out. But usually we're going to get our patients out, rescue or remove the patient in a safe, calm manner. We then are going to activate the alarm. We want to make sure our patients are safe and everybody is safe before we pull that. We're then going to try to contain the fire. If we can, you know, you can use that fire extinguisher. Maybe there's 2 or 3, but there's times that it's just too big. And what we're going to do then is close the door and get everybody out. And then we are going to go to the E, which is either extinguish the fire if we possibly can, or evacuate the area. And if we can't put it out with those fire extinguishers, we've got to get everybody out and make sure that they're safe. The one thing we want to make sure we do is don't let everybody go in 16 different directions, because what happens is we have to know where our patients are. We're responsible for knowing that they're okay. So we need to make sure we tell our patients to stay put. We need you to stay in this area, and somebody will be there to make sure everybody stays. So if you go to page 267, there are those steps that talk about race. Again, it tells you even more past the race. The one thing that's really important is we've got to make sure the exits are always clear. Don't prop open fire doors. They are there for a reason. They close and they can help contain the fire to just that portion of the building. So it's really important that we keep the exits clear and don't block the fire doors. Make sure you know where the fire is and you have a way to escape. You don't want to be the hero. The fire department is coming. You want to make sure that everybody is out and that everybody's okay. If there's smoke, I hope you know this, we're going to get everybody down to the floor. The smoke is going to rise, so the best place to go is to the ground, and that's where the clearest, the air will be, the smoke hopefully will be above us. If it's not, we can dampen a towel or some type of piece of clothing or something that we have to put over their nose and mouth to help them breathe. Because remember, smoke inhalation is a huge killer in fires, so we want to help prevent that. And before you open a door, make sure you touch the door and you're checking the temperature of that door. If it's hot, don't open that door. That means there's fire behind it, and if you open that door and give it more oxygen, it can just poof up, and that's going to be really, really difficult. If you are trapped in a room or the door is too hot to touch, we're going to try to stay in the room. We're going to get down on the floor, and then we're going to try to put wet towels or blankets under the door so the smoke doesn't come in. Okay? So again, that's on page 267. For those of you that use the ebook, it would be table 11-5. And again, we have just cute little pictures: remove, activate, contain, extinguish, or evacuate. Preventing electrical hazards. And again, to me, this is common sense, but a lot of times when we get so again, and a lot of times these are just common sense things, but sometimes people are not always equipped with common sense. So we want to make sure that we're using the equipment properly. If we can't, do not jerry-rig it to make it work. That is not good. If it's not working properly, we need to put it out of service and take it to the biotech people. We don't use damaged equipment. If we look and see an electric cord is frayed or there's something wrong, we need again to put it out of service. We don't want to electrocute our patients or ourselves. We want to make sure we're not using electrical activity or electrical things around water. And if by chance we have somebody that is being electrocuted or is being shocked, don't grab them because it's just going to start to go through you. What we need to do is turn the main power source off so it stops that electricity current, and then we can go and get the patient. Okay, so question: true or false? RACE is an acronym for putting out a fire with a fire extinguisher. And that is false. PASS is the acronym for, RACE is the acronym for what you do when you discover a fire. Okay? PASS is using the fire extinguisher. So when we look at chemical hazards, We use chemical compounds and chemicals a lot in healthcare. If we use bleach, that's considered a chemical. So one of the things that we have to do is we have to be very aware of what we're using that can be hazardous to us. And that is when we start and look at the safety data sheets. Every chemical we get has a safety data sheet that goes with it. And so in order to work with that, you as an employee should have access to that and be able to read over it before you are required to use it. When we're using chemicals, you want to check the label 3 times. I know that sounds crazy, but there are chemicals that are very close in name, just like medications. So we need to check it 3 times to make sure we have the right thing. Look on the safety data sheet and see if it's compatible with the thing that if you're going to be mixing things. Make sure they're compatible. That what you don't want to do is have an explosion or a fire or some type of toxic gas that you're exposed to because we've mixed things that are not compatible. We even have to be careful when we store chemicals. And again, your safety data sheet is going to tell you that. Don't store this near this, or this. So it's really important that you check the safety data sheet to when we're storing chemicals and when we're using them. We always want to avoid contact with them. If we are using them, we can wear gloves or even heavier gloves depending on if it's a corrosive type material. And again, face shields so we don't splash it into our mouth or our eyes. The big thing here is if it's not labeled, don't use it. Okay? Do not use it. Now, when we talk about splashing in the eyes, if something does happen, then we're going to use the eye wash station. And I think I have a picture of it coming up, but if I don't, you need to look at that, hint, 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 because that could be on a test. What we do is we rinse the eye out for a minimum of 15 minutes to make sure that that is nice and that we've hopefully gotten all that chemical out. We then let everybody know and do an incident report. Don't do the incident report first. Get to that eye wash station, wash that eye out. Okay? The other thing we talked a little bit about is wear protective PPE. On that safety data sheet, it is going to tell you what PPE you need to wear. And so it's very important that you look at that and you know what you're looking for. If there is a chemical in the area that you're working, the safety data sheets have to be available to you. If we have any spills, we need to clean up any spills immediately. And if it comes in contact with our skin, we should wash that and rinse that for at least 5 minutes. So here is a safety data sheet. I know it's really little and there's no way I can read this to you, but you can see there's an OSHA brief. It talks about how it's identified. It's going to give us the hazardous identification. There's a number of these cute little icons when we talk about the hazards notifications, and you need to be aware of what those are. The ingredient information, first aid measures. What do we do if we're exposed to it? Firefighting measures. If we do start a fire, what should we do? Accidental release measures. If something happens that we release this out into the atmosphere or whatever, we need to know how we handle and store this, how we use exposure control and personal protection. So again, do we use goggles, masks, gloves? What do we need? Physical and chemical properties. So this is going to let us know, what's going to happen if we mix and those type of things. Stability and reactivity. Toxicology information. So how toxic is this little devil? It's going to tell us. Ecological information. And this is really important. If this is a chemical that you think you're going to put down the drain, you need to check with your local water agency. We use Sidex every year to test for cleaning equipment and instruments. Before I can dump that down the drain, I have to call the Cumberland Water Department, let them know, and double check to make sure that I am allowed to dump the Sidex in the drain. If I'm not, then I have to repackage that, and there is a special company that comes and picks up our chemical waste. It is really important because you can get fined tons of money if you throw something down the drain that shouldn't be down there. Okay? Again, talks about disposable considerations, transport information, regulatory information, and employers' responsibilities. So that all of that information is right there on your safety data sheet. Radiation hazards, again, this is going to be in X-ray or in radiation therapy. Most states only allow rad techs or radiation therapists to work with the X-rays. But some people in some states like Virginia, medical assistants can do limited radiology type procedures. So what happens is, just like at the dentist, or when you go get an X-ray, they put those lead aprons on. We have gloves. And we also, if we're going to be the ones doing the X-rays, we are going to wear a dosimeter. And what that does is it records the amount of exposure. And those are changed every month or whatever the longevity of the dosimeter is. Disposal of radioactive waste. Again, not something that we're going to throw away. Radioactive material comes in special containers, and it has to be handled properly. And the same way when we are ready to dispose it. It has to be placed in a special container. It has to be labeled radioactive. We should never incinerate, throw this in the regular trash. And only those licensed people that are allowed to move radioactive material can take that away. Infectious waste. It's any item that has some type of body fluid on it with a potential to transmit disease. Now, I'm not talking about a drop of blood. I'm talking about like a blood-soaked bandage. Biohazard trash is very expensive to have taken away. So we use this with care, but we want to make sure that we're not just throwing regular stuff into the biohazard trash. So this is the biohazard symbol, hint, hint, symbol. I do not have the eyewash station symbol here, but I would suggest to look it up. It's just green, and it looks, you have a head, and it's got like water like coming towards it. You need to follow the policies and procedures at your agency. You need to know them. You know, what's considered, biohazard waste, what's not considered biohazard waste. And if we have been accidentally exposed to something, we stick ourselves with a dirty needle, you know, we have an open sore on our hand and we haven't worn gloves. That all requires documentation. Again, you're probably going to get yelled at, but you need to document that for your safety as well, because that would be a work related injury. So if something would happen within 5 or 10 years and you picked up some weird thing, you would have documentation for that to go back on. This is a biohazard trash bag that would go inside the biohazard trash can. And don't be fooled. Sometimes these are regular trash cans with a red line trash bag inside. So if you see a red line trash bag, that is biohazard waste. And then we have Sharps container. This is what anything that can stick, poke you, glass, syringes, anything like that goes into the Sharps containers. Using oxygen, we are always going to post an oxygen in use sign. We do not want to have any form of fire, electricity, sparks, anything like that. Even static electricity can cause a spark and can cause a nasty burn from the oxygen. So you have to be very, very careful. We never use flammable liquids or ointments. A lot of people will say, oh, I'm going to use Vaseline because my nose is sore. That is a flammable ointment. We don't want to use an oil-based lubricant on their nose. We always want to use a water-based lubricant to help them. Oxygen tanks must be secured either in a tank holder or chained to the wall. That's very, very important. We do not smoke around oxygen. And again, the woolen synthetics we try not to use because those are the fabrics that cause a lot of the static electricity. I have seen, as a respiratory therapist, I have seen a lot of people who have smoked while they were on oxygen. I don't know how they got so lucky to not have a burn, but I've also seen patients who have smoked and they have massive burns on their lips all the way up their face because while they were smoking, the oxygen ignited and they had terrible burns up their face. So turn the oxygen off. I'm not saying that people can't smoke because I'm not telling a chronic lunger they can't have a cigarette. I'm saying if you're going to do that, turn the oxygen off, get them out of the area where the oxygen was being used, then they can do that. Then we put it back on and take them back to where they were. Okay, another question. Which of the following is the best first step if a chemical comes in contact with the skin? Should we rinse under cool water for at least 5 minutes, immediately go to the emergency department, or cover the area with antibiotic ointment and dressing? Well, we want to rinse that. If we don't rinse it and wait to go to the emergency room, we can have a much, much worse burn. So we want to get that material off of our arm or body part or whatever it is. And then we can go to the emergency. Remember, for the eyes, it's 15 minutes. Bioterrorism. You know, we think that this is rather a new concept, but it's not. They used to take bodies that they knew had the plague, and they would plop them in the middle of a village to wipe it out. So this has been used for a long, long time. But when we talk about this, the most recent ones are things like anthrax, smallpox, and those are the ones you may be more familiar with. On page 270, and it's table 11-6, it talks a little bit about the chemicals or the disease, that we get. And it tells us how it's transmitted and what type of precaution we need to use. So when we're talking about anthrax, and it can be 3 different kinds. It can be cutaneous, which is the skin, GI, which is the gastrointestinal system, or pulmonary, something we have to breathe in. There's possible transmission to a person if it's on your skin, but if it's GI or pulmonary, we are not going to transmit it to anybody else. And all we need to use is standard precautions. Remember, we should use standard precautions for every single patient. We should think that everybody has some type of disease, and we're going to protect them. We're going to protect ourselves and our patient. Botulism, again, is not transmitted person to person. Neither is the plague, the bubonic plague. And it is, again, standard precaution. But when we get into the pneumonic plague and smallpox, those can be transmitted person to person. So the pneumonic plague is the ones that just would, they'd put something in there, a sick person in, and just infect a whole area. With a pneumonic plague, we would use droplet, which is kind of what we're doing for this coronavirus. That's going to be droplet, where it comes out and drops on to the table. Smallpox is airborne. That's a little different. With airborne, the particles stay in the air and float around. So we have to use much more caution with that. When we work in a facility, usually in an acute care facility or at the hospital, when the offices are attached to that health system, and we're seeing this more and more, there is an emergency code system that's used. And it's a communication method for the employees that is used so our patients don't freak out. So what they do, if it's a fire, they may call it a code red. A code blue would be a medical emergency. Somebody's having a heart attack. A code green is an emergency plan is activated, kind of like we're in right now with the coronavirus. Code amber is a child abduction. Code purple is a missing patient. And you actually can wear these on the back of your name tag. So they would give you that little hangy thing. You can see right here is where it would clip in. So just in case you can't remember what the code is, you have it right there and it's available for you. Okay? Emergency preparedness plan. This is huge. You should have one for your family. You guys should all have an emergency fire plan. You should do fire, the little fire drills and everything. We used to do that with our kids because panic sets in when they hear the word fire. So we used to be a game. They would go to the closest exit and all those wonderful things. But you really should have this. We found out with this emergency, with the coronavirus, people were not ready. People went a little crazy, bought all the food and water that there was, but medicine, you should have a certain amount of medicine in case the drugstores weren't open. You should have enough drinking water. You should have some canned foods. And so I think for the whole world right now, I think we have found that we were not anywhere near prepared for this coronavirus and this pandemic. We failed terribly. So this is something that we need to think about and put into place. When we're in a facility, that emergency preparedness plan is going to be different. We are going to be following OSHA requirements. So let's say there is a fire in the building. This emergency plan is going to go into effect. There's going to be policies and procedures. It's going to say this group of people is a fire brigade. This group of people should be doing this. Nursing assistants should be doing that. Respiratory therapists should be turning the oxygen supply off and going to the ventilator patients to be able to ventilate them because, if we have to move them, that cord to the ventilator is not long enough. There's always going to be a charge person, and that's where you go to get your instructions. You know ahead of time what your responsibility is, but you always go to that charge person, and you will know where they are. We always ask what we can do to help. Sometimes it is triaging, just helping people move from place to place. One of the things, again, clear communication. We can really mess things up when we don't communicate well. So that communication piece is important. The other thing that they have found out in emergencies, that cell phones are not great because everybody is on them and it just totally shuts down the network. They found this out with 9/11. So now these facilities have certain radios that have a frequency that's just for them. During these emergencies, these horrible things that have happened, we have learned things to better prepare ourselves for the next emergency. Okay, we shouldn't be on the phone chit-chatting with everybody. We should be using it only for those emergency business purposes. Triage system. This is where we're going to be able to assess the patient's condition. Sorry, that was my grandson FaceTiming. So the triage system, again, that's where in an emergency situation that all the patients go through here, and people are going to be assessed on their condition. Now, what you have to remember is in an emergency, things are different. Just like here with in Italy, when the 80-year-olds were told they were not going to be put on ventilators, they have to look at how are we going to get the country back on its feet. And saving 80-year-olds is not going to be the way to do that. So what they're going to do is they're going to triage and put people in different areas. And the people that are, of course, less hurt would have to wait. But they're going to look at what the person has to offer, how they're going to be able to bring the country back. So all you young guys are in good shape. Us old people, we aren't in such good shape. But depending on the, again, severity of the illness and what's going on, that's how people will be treated. We use this during disasters, and really on a daily basis, we use this in the ER because we talked about this before with the ABCs. And so if you've got a cardiac issue, if you've got bleeding or an airway issue, you're going to be seen first in the emergency room. So if you've just got a little scrape on your knee or even a broken bone, you're going to be on the low end of the list because they're going to take people in that are not doing, that have those issues. And that is it for chapter 15. Thanks very much, guys. We'll see ya.